Did you know that about 50% of people with hepatitis B don't even know they're infected? Meaning you could have hepatitis B right now and not even know it. Today, we will go over the causes, symptoms, and how you can prevent getting this virus. But first, let's talk about the hepatitis B virus. Hepatitis B, or Hep B, is a virus that causes infection and inflammation of the liver. The Hep B virus can be found in bodily fluids such as blood, semen, vaginal fluids, and even amniotic fluid, which is that liquid that surrounds a developing fetus during pregnancy. But how do people get infected in the first place? Well, common ways people get exposed to the virus include needle or syringe exposure, where a needle or syringe used by someone with hepatitis B is then used by someone who doesn't have the virus. This could happen through an accidental needle stick injury or through sharing needles. There is also mother-to-child transmission, where a mother infected with hepatitis B passes the virus to their child during birth. This can happen because the baby may come in contact with the mother's infected blood or bodily fluids, increasing the risk of transmission. You may also get it by having unprotected sex with someone who's infected. Basically, if you come in contact with infected blood or bodily fluids, there is a risk of contracting hepatitis B. Though hepatitis B can be found in saliva, it's not spread by kissing, sharing food, coughing, or sneezing. Symptoms. Okay, so what happens if you do get infected with Hep B? Once a person is infected, symptoms may not appear until 1 to 4 months later, and some people may never develop any symptoms at all. When symptoms do appear, they can include abdominal cramps, fever, vomiting, and extreme tiredness. Symptoms of liver disease will appear as jaundice, which is the yellowing of the eyes and skin. Individuals may notice dark-colored pee and clay-colored poop. Now, hepatitis B can cause two types of infection, acute and chronic. Acute Hep B is a short-term infection, meaning your body is able to clear the virus on its own within 6 months. Most people usually get this type of infection. The other type of infection is a chronic infection, where the body is unable to get rid of the Hep B virus at all, and the individual will have this virus for their lifetime. This type of infection affects a small percentage of adults and 90% of infants. Individuals with chronic hepatitis B are at increased risk of developing liver failure, liver cancer, and cirrhosis, which is a severe scarring of the liver. So what can you do to prevent yourself and others from getting the virus? The most effective way to prevent hepatitis B is through vaccination. Getting the hepatitis B vaccine will provide 90% of protection. Avoid sharing needles and personal items like razor blades and toothbrushes, as a small microscopic amount of blood is enough to cause an infection. Wear PPE such as gloves if you need to clean up bodily fluids, and practice safe sex, since hepatitis B can spread through bodily fluids during sexual contact. Now let's recap. Hepatitis B is a virus that affects the liver and can be found in bodily fluids such as blood and semen. Symptoms of hepatitis B can include abdominal cramps, jaundice, though some people may not develop any symptoms at all. There are two types of infection, acute and chronic. Most adults will go on to get an acute infection where the body is able to clear the virus within 6 months. However, some will go on to develop a chronic infection where the body isn't able to clear the virus at all. With a chronic infection, there is an increased risk of liver failure and cirrhosis. The best way to prevent this virus is to get vaccinated and avoid sharing needles. Thank you guys so much for watching. I hope this video helped you get a better understanding on what is hepatitis B. If you learned something new, don't forget to give this video a big thumbs up. Feel free to leave any comments below. I will leave a link to more videos if you'd like to do a deep dive into more diseases. Stay healthy, stay safe, and I'll see you guys in the next one. Bye.